All right, everyone. I don't think there's anyone else in the waiting room, so we'll go ahead and get started. For those of you that I don't know, my name is Elizabeth Faber, and I'm the director of Iowa Immunizes, which is a project of Iowa Public Health Association. So I'll be helping to facilitate today, but don't worry, you don't have to listen to me the whole time. So we'll do some official housekeeping right now. So thank you for attending our December 3rd Thursday Lunch and Learn, the last one of 2024. So going out with a bang. Please note that this session is being recorded and we will post it to the IPHA YouTube channel. And we're in the process of finalizing the spring season, all of the sessions. So stay tuned for the release of that in the upcoming weeks. And just a reminder, your one-time registration is good for that entire 2024-25 season. So some additional housekeeping items. We're going to please make sure your microphone is muted during the presentation, and this helps for everyone else to see and hear the presenter. Please go ahead and put your questions in the chat. We'll have time at the end for questions, of course. We want it to be a conversation, but just so you don't forget, put it in the chat. And there's going to be, plenty of time for live discussion. And at that point, you can take yourself off mute and turn your camera on, ask questions if you'd like. All right. So with that, we'll go ahead and get started. Today, we are joined by a familiar face to most of you, Deborah Thompson, who is an IPHA board member, and she's the president of DHT Consulting and Training. So she's going to be talking with us about Iowa's rich public health history, rich with stories of controversy, as well as all of the things that we can learn from our ancestors that should help us better understand public response to public health policies and interventions. So that's a lot, and we're very, very glad you're here to come along on a journey of discovery and connection with our IPHA's 100th year anniversary coming up in 2025. We're only a few weeks away from when we get to start celebrating. So Deborah, thanks for being with us today, and I'm going to turn the mic over to you.
Thanks, Elizabeth. I appreciate the introduction. Today, just like you said, I'm talking about a fun project that we're starting up in alignment with IPHA's 100th year anniversary celebration that will continue all next year in 2025. It's going to focus on Iowa's public health history. So I don't have all the history documented, just a couple of choice stories that I thought were fun for today's presentation. But it will focus on Iowa's public health history and will include IPHA's own contributions and the State Board of Health as well. So I'm going to continue by sharing the scope of the project and the goals. So the goals are to develop a shared understanding of Iowa's public health history, again, including the role of IPHA. I have been a part of the public health community since 2011, I'd say, and I haven't seen much of this. And so I'm wondering if there's just a gap in knowledge and we would owe it to ourselves to develop a shared understanding of it. And then I also want to provide a safe space for discussion of what we as descendants can learn from our ancestors about how they handled controversial issues and what they look like in their time, because there's a lot of familiar stuff in there compared to what we're dealing with today. So during the height of the pandemic, I was so confused about many things that I started to seek answers. And I was raised in a family that talked a lot about history. And so I turned to history for answers. And then life kind of moved on. I had purchased books and thumbed through them on Iowa's history and United States public health history, but had just kind of picked them up and put them down over the years as the height of the pandemic. We kind of moved on and returned to normal, as they say. But when I rejoined the IPHA board in alignment with the 100th year anniversary, my interest peaked again. And over the summer, it really turned into a passion. And because I'm an IPHA member and member of the public health community here in Iowa, but mostly because I'm an IPHA member, I got to hang out with Maria Torres and Ann Crody, and touched base with them. Maria is a fellow board member. She works her day-to-day is at Potawatomi Public Health. She is a health equity proponent, huge advocate, and is the chair of IPHA's JEDI committee. Anne is a member of that committee. She works for Iowa HHS. And in conversations with them, we just started to kind of talk about ideas and what we could do with history and Jedi and lessons learned. So we had the ideas. In other words, public health is never short of ideas, but we are short of funding a lot. But luckily, APHA had a $5,000 grant opportunity for health equity, and we applied and we were awarded. So now we can have an intern to help us with the research, and we can reimburse volunteer expenses. So some of the books on Iowa's history are not in print anymore, so you might have to track down a hard copy, and we could reimburse for those expenses. I'll talk about some of the other ways that I researched that involved getting some subscriptions. But the good news is that any expenses that we do through this project can be reimbursed, and we could also provide honorariums to partners we collaborate with on the grant's deliverables. So that's exciting. So our team, it will be led by me. Whoever that future intern is. And then IPHA staff will kind of support it, but we're trying to alleviate them from any burden. And then we'll extend invitations to the 100th anniversary committee members and the JEDI committee members, but especially to any of the IPHA members. Would love to open this up as a project for anyone who is interested in learning something about public health history. Part of the project will be a transference of knowledge and skill sets. So I have, I think I'll brag a little bit. I would say a commanding understanding of the General Assembly's website. And so what I'd like to do is just kind of help people learn how to use the website, how to use just different avenues to pull in the information they might be curious about. So everybody can come with their own areas of interest, and we'll work together to figure out how to add to your story, add to the story, research the history. It's all kind of storytelling in the end. And this quote kind of sums it up for me. History cannot give us a program for the future, but it can give us a fuller understanding of ourselves and our common humanity so that we can better face the future. So the whole idea of recording and remembering history is so that we can learn from it and not repeat it. I don't know who Robert Penn Warren is. I haven't read any of his work, but I liked his quote. Also during the pandemic, my friend Randy Mayer suggested that I read The Health of the Republic by Dan Beauchamp. I did, and I found it really insightful. There's so many ways that we can hone in on public health history that I did want to bring in some kind of parameters, just even like for myself, because there are so many rabbit holes that you can go down depending on the subject and how you want to like what lens you want to look through. So with that said, the author of this book proposes that there's 3 underlying themes when folks argue over public health actions and activities. Economics, so they argue over people's money; liberty, people's freedom; and morality, which is our judgment of people's behavior as right or wrong, good or bad. So regarding economics, most public health policies will have a negative economic impact of some kind on some group or groups in the population or on some industry in the private sector. Stakeholders will push back on public health regulations on the grounds that it might cost jobs, it might add to the price of a product, might require a tax increase. They don't want regulations decreasing their profit margins, but they also don't want customers upset about prices, or employees upset about trimming back pay or removing benefits in order to cover the costs of a new regulation. So it does put business owners in a tough spot. And history has a lot of stories where economic impact takes center stage in the 20th century. So, milk producers resisted pasteurization, landlords resisted building codes, car makers resisted design changes to improve safety, which is ironic given that's one of the biggest selling points these days in a car is how safe it keeps your family. So, just saying. Bar owners resisted smoke-free air laws. We saw that in Iowa. It was very controversial here, and there were lawsuits several years after the fact. But now when I speak to students in at the College of Public Health and Gen Z, they can't imagine a time where their food was interrupted by someone's smoking in the smoking section that allegedly contained all the smoke. I mean, they just can't imagine. They just can't imagine. Um, but there was that controversy at every turn. In my research over the summer, I stumbled on a really interesting example of public health controversy that was caused by economic concerns. And it was called the Cow Wars. I'm a transplant from Iowa. I'm from Texas. In Texas, you are required to learn Texas history before the United States history. I don't know how it is for Iowa, but this was new information for me that there was this thing called the Cow Wars in 1931. I'm using Canva presentation, which is a little different for me. So I made my blue dot. All right, maybe I'll just go here. Oops. Okay. So in January of 1919, Governor George W. Clark gave his condition of the state speech to Iowa's state legislature. So this is Governor Clark, and this is an old-timey picture of Iowa's House of Representatives. So the governor gives his annual speech in that chamber to both senators and representatives because it's a big chamber and it can fit everybody. The Senate chamber is smaller. Anyways, he's there in 1919. He's giving his condition of the state, and he includes a call to action that they pass a law to require testing for tuberculosis in all dairy and purebred cattle. The state would take and dispose of the cattle that test positive, and the owner, however, the farmer, would be compensated, but only partially, in kind of a one-third, one-third, one-third mix of state funding reimbursement, federal funding reimbursement, and then the farmer foots the rest of the bill. The governor's reasons for asking for this requirement is, and this is his quote, "The tuberculosis cow is responsible for an appreciable amount of tuberculosis, especially among children. It's also demonstrated that the prevalence of tuberculosis in the dairy districts of Iowa is vastly greater than in other sections of the state." He then discusses at length that there is an economic burden on the industries impacted. But, and he kind of, well, I'll say, uh, he says, "It's not wise for an intelligent people to tolerate so great a financial drain," so that's the loss of the cattle, "or to subject her people to the imminent perils of the tuberculosis cow." And so there he really sets up the economics versus the public's health argument. A bill passes the Senate that year. This is 1919, but it dies in the House and becomes kind of an annual issue over the next 10 years, where testing is voluntary, but does not become required until 1929. So, and 10 years later, so we asked for 1919, and Iowa kind of just, as we do, drag our feet for a little while. And it finally gets through 1929. So it had been voluntary up until then. And I think that the voluntary stuff worked for a while because a lot of the counties were banning purchases of cattle that had not been tested. So this demonstrates the importance of local control when the state fails to act in the public's interest. So if the county feels strong enough, uh, they can have some say in how they protect the public locally because they are also responsible for those lives. Um, so after testing became mandatory, some of the farmers sued, and the law was affirmed by the Iowa Supreme Court. It was upheld. Most of Iowa's farmers complied, but not everybody. And so farmers over here in this region, the southeastern part of the state, and concentrated in Cedar County, this is where there was actually violent resistance to testing of their cattle. And so if a state veterinarian would show up to test the cattle, they might be chased off the land, quite frankly. And the Peak incident involved 300 farmers armed with crude weapons, ambushing 63 law officers and 2 state veterinarians. Fortunately, no one got seriously hurt, but it's kind of hard to imagine. So, Governor Dan Turner called in 1,900 National Guardsmen the day after to intimidate the farmers and to send them home so that the cattle could be tested. So it was like a whole scene that was, even at the time in the newspaper, they said it was quite uncharacteristic of Iowans to behave in such a violent way. So why were the folks in Cedar County and the surrounding counties so riled up? Why were they particularly angry compared to the rest of the state's farmers? Well, because of this guy. So this guy's name is Norman Baker. He was born in Muscatine in 1882, and Baker dabbled in a number of money-making ventures that ranged from mail order business for dry goods to a traveling mind reading act. I found some pictures of him um, using hypnosis on people. Um, so he ran that mail order business. He was a part of the vaudeville scene, and he did all of that before he decided to sell himself as a healer for cancer and other more common ailments like hemorrhoids. But his cancer cure and his following really took off thanks to a radio station that he launched in 1925 in Iowa with the call letters KTNT, which stood for Know the Naked Truth. Know the Naked Truth. Eventually, the station broadcasts like across the Midwest, and Baker used its reach, and he also had a print publication to promote his cure, slander his personal enemies, and denigrate the mainstream medical establishment. So a favorite target of his was the American Medical Association, which he accused once of trying to assassinate him. They might have. I mean, I think the AMA was a little bit gangster back then, and definitely fought their own battles over things too. But my point is that Baker was not a doctor, he was a con man. And over the airwaves, Norman Baker encouraged cattle and dairy farmers to resist voluntary testing of their herds. So he actively spread disinformation about the effectiveness of the TB test. He created mistrust of the government officials and of medical professionals. And he was just as mean, loud, and wrong as today's loudest opponents. Cedar County farmer Jake Lenker, who was later sent to prison, had been influenced by Baker's rants. And it was on Lenker's property where those 300 farmers that I mentioned earlier violently blocked the testing, prompting the National Guard to be brought in. The New Yorker published a profile of Norman Baker in 2022, and it discussed at length a hotel he owned in Eureka Springs, Arkansas. Oh, That's weird. I didn't realize that I was making marks on here. Okay. Anyways, this is the hotel turned hospital that he opened in Arkansas, and he conned cancer patients into believing that he had a miracle cure for it. He did not. And through the years, authorities, they did try to shut him down many times. The Federal Radio Commission revoked his broadcasting permit, but he just moved to Mexico and then increased the wattage of his reach. Doctors and scientists published articles debunking him. Law enforcement tried to imprison him for practicing medicine without a license. He served just a day for that. And every time they came at him, he just folded these setbacks into his narrative of a jealous medical establishment working to destroy him. So what finally brought about his undoing was charges of mail fraud. He served 4 years in Leavenworth and then retired to Florida and lived until his death in 1958. Norman Baker. I've never heard this guy's name, but I swear you could swap out a lot of names that we saw at the height of the, I mean, even now and today, like Del Bigtree or RFK, or Alex Jones, any of these guys. They've always been around. Is it just on there forever now? I'm sorry. I'm using Canva.
No, I think for some reason a participant was able to do that on accident, and I don't know. I think I turned
Oh,
off
it's not
the
me.
permission.
Oh, okay. It doesn't
So
bother me,
okay, I
but
don't know how to redo it. I don't know how to
okay.
undo it either.
It's like the annotation
Yeah,
that, like, if you touch the annotation button,
yeah,
that's fine.
yeah.
Okay. So that's a Zoom feature, actually. All right. So yeah, so in that story that I just told, there's a lot of different aspects regarding people's money. So in the background is the start of the Great Depression. That's the setting for the story. And it was a very scary time. Farmers who raised the cattle had economic hardship already because of the Depression. And then on top of that, the change in the required mandatory nature of the law. So they would lose additional funds if their cattle was testing positive. The farmers who raised cattle that didn't want to lose the business from the counties they worked with also had to think through the economics of getting the risk of getting the cattle tested versus the risk of not being able to go into many of Iowa's counties and sell their goods and their cattle. The local municipal ordinances provided economic incentive. Again, okay, I just said that. And then Norman Baker was a grifter who wanted money from people, and people gave him money in search of miracle cures. And then there's the cost to the taxpayers for the police and military protection. It was not cheap to send law enforcement with veterinarians every time they went to a hostile farm. And it certainly wasn't cheap to send 1,900 troops over to the farm, but he wanted to make a big show of force. So, with all of that said, I wonder if we, as the public health community, pause to reflect on the story, maybe in the space of the work group that we're creating for the project. What are the lessons learned here? What can we take away? If you know me or you have taken my trainings on persuasive communication, you've heard me encourage the use of the language of ethics, morals, and values and number versus using numbers and graphs. Again, when you're trying to persuade someone. I was the legislative liaison for the state health department for 7.5 years. And it was something that I learned through my experience there. Was that I was more successful when I was speaking to values and morals than I was when I brought over a one pager filled with data and numbers. That's not to say data and numbers aren't important. It's just to say that there needs to be a balance, and people respond and make decisions using their morals and their language more than they will the numbers and bar graphs that you show them. So to me, when I think about the morals that are in play in this story, I settle on fairness. So in my training, I would say that these morals are paired with a positive and a negative. So the opposite of fairness is cheating. So the farmers and the government were arguing over the fairness of the compensation, the fairness of a government able to come in and step on someone's property and effectively take it if it didn't meet standards. And so the farmers felt cheated in many ways. Care versus harm. Just as the governor set it up, it's crazy not to care that children are dying because they're drinking infected milk. But it's also, I mean, this causes harm, and suffering. It's also hard to not care for someone in their, they want to have financial sustainability and or financial stability, because it's harmful if they can't put food on the table for their family. And then another moral value that's in play is the value that we place on authority figures in our society. So there are authority figures like doctors. In this story, the authority figures are these state veterinarians. I read actually that the veterinary field was sounding the alarms faster than the medical and public health field about the transference of tuberculosis from cow milk um, to humans. And so, anyways, but they were in charge of the testing. And so the veterinarians in this case were part of the authority of the government to be able to do this per the law. And Norman Baker was actively subverting that authority by the disinformation that he was spreading around. But not so much that the authority of the military folks that came on, they certainly didn't, they complied after the troops showed up, in other words. So how we use authority in these issues when controversy comes up is important. It's almost like you have the layers of authority. You have the subject matter experts who are authority, and then you have the military folks or the law enforcement public safety folks. Okay. But the questions that remain for me here that I want to continue to research are what the public health side of the story. So when this was going on, what was the state board of health saying and doing about it? What were local boards of health? What did those conversations look like as they were making those decisions to ban untested cattle from coming into their county? And then the politics. I researched that Governor Turner was a Republican. So the idea that a Republican governor sent in troops to defend a public health intervention, I thought that was really kind of neat to see it supported in that way. Because, I mean, to be honest, I think the Republicans in Iowa right now would have probably more likely joined the farmers in their protests than defend public health. But at this time in American history, the Republican Party was going through another ideological change as it is now. So understanding politics also matters, because just because the Republican Party has been around since Abraham Lincoln started it in the late 1800s doesn't mean that it's taken the same value system all along the way. So it's important for us to be able to kind of discern, like, well, why would a Lincoln Republican versus a Trump Republican, like, what are those differences, and how do we kind of use those to inform when we're seeing a person who calls themselves a Republican that's more in line with a Governor Turner type of Republican, and what does that mean, and how can we find those partnerships, and things of that nature. So just understanding political alignment and not necessarily in the nuances of it to find partners that will support you in government at any age of time. All right. I can stop now if there's any questions there. Okay. So going back to these three categories of discourse offered by Dan Beauchamp, liberty is the next one. So one of the central controversies in public health is the extent to which government can and should restrict individual freedom for the purpose of improving the community's health, the public's health. Many Americans reflexively oppose being told what to do and resist the idea of governmental restrictions on their behavior, even when the intent is to protect their own health and that of others. Public health professionals, I think, are pretty familiar with this argument, just because liberty was a huge theme of debate amid the COVID lockdown policies, the mitigation strategies, and vaccine mandates. So people were very concerned about their freedom and government overreach at every single turn. As a society, we've pretty much been on the same page about restricting people from harming others. So when Moses brought the 10 Commandments down, we were all kind of like, yeah, you're right. I probably shouldn't be able to murder people. Um, so murdering and assaults have kind of been off limits for thousands of years. But when the harm is less direct, the issues are more controversial. So laws that restrict what people can do to themselves are intensely debated. So there were heated debates over tobacco cessation laws, alcohol control laws, and we had a lot of interesting stuff go down during the Prohibition era. Laws meant to decrease the consumption of sugar and trans fat. It's just kind of that it's my body, it's my choice. I'm not hurting others. So I should not be restricted in my own personal choices, my own personal behavior. So this is where I'm doing this as a volunteer and Christmas parties kind of took over. So I apologize at the messiness of these next few slides, but I did the best I can. Um, when the COVID vaccine came out, I think, at least the folks in the Iowa Immunizes Coalition were over the moon. I volunteered at a Hy-Vee vaccine clinic and with a few of my friends from the public health community, and we were just overjoyed and hyper and excited, and no one else in the room was. So I probably should have read the room there, but I was just so proud of my country, that I was really surprised that our uptake rates plateaued as quickly as they did. They leveled off. We spent millions on campaigns and incentives and enlisting trusted voices to implore vaccination. And we did make progress, but it was very like, what's the word, like a grind progress, like a scrape the progress together and get a few arms here and there. And I wonder, as my research kind of showed, just the stuff I did over the summer, it turns out that Iowa has some examples of pretty significant vaccine hesitancy in our history. And I just wonder what those conversations would have been like in the Iowa Immunizes Coalition had we known this ahead of time. I don't know if it would have changed our approach in any way, but it just was like, huh, that's interesting. And so some of the first stuff that I came across was the smallpox vaccine hesitancy. So this article here mentioned, this is from 1941, and it mentions that smallpox is the worst in the nation here in Iowa. And it discusses that mandates for childhood vaccinations for smallpox had been um, implemented in 21 states. Actually, I shouldn't say it was just for children. I'm not really sure what each of these laws said, but mandates of some kind have been passed in 21 states. And that as a result, 4 of them had completely eradicated the disease. So that was in Maine, Massachusetts, New York, and Rhode Island. But Iowa's numbers were still really big at a time where other states were having 0. So we were still experiencing like 700 cases in a year. This article here is from 1932, where other states started to get kind of irritated at Iowa for sending all of our smallpox to their state. So, director of maternal and child health division in Pennsylvania wrote a letter to our state board of health chair and let him know that we have had a law in place since 1925. We've only had 9 infections of smallpox since then, and 7 of those cases are traced back to Iowa. So I just found that very interesting that we were even being pressured from outside states to change our laws, and we didn't. I also thought it was really interesting to read through the letters to the editor that were there in that time and really just saw some similarities in the arguments that were provided, especially around liberty, and whether or not the government can regiment, as it says here, the whole life of free Americans. And if we want our whole life to be regimented by the government, then we should pass that law. Go ahead and pass that compulsory law. And this is from a mother, or a woman, anyways, from Grinnell. And then down here, it's someone who is pro vaccination mandates and points out, as I remember hearing folks point out um, during the height of the pandemic, that we make it mandatory to vaccinate our animals. Why wouldn't we do the same thing for our children? So making that same argument with smallpox, um, I just thought was fascinating. So the questions that remain here, I also learned in my research that Iowa was the last of one of the last 2 states to implement childhood vaccination laws. We didn't do it until the early 70s. There were many bills, but it was Idaho and Iowa that were the last to commit to that public safety or that public health intervention. I wonder, um, there's a lot of articles that are kind of similar to what I have here on smallpox, where you had folks competing in the opinion articles. Um, what was interesting was finding information on the diphtheria antitoxin, where medical professionals, physicians were actually the ones keeping it out of the counties. And so that started to make me wonder about the dynamics between the public health nurses and the physicians over at the Iowa Medical Society. And at every stage, who were the allies and who were kind of the opposition, and how some of these relationships unfolded over time. But in these, it is always clear that it is um, the care versus harm morality of local groups and local public health professionals organizing themselves, organizing vaccine clinics, and going door to door if necessary. Just the sheer power of good, I feel, that got us over the edge in these cases. So Iowa doesn't suffer from these things anymore, but we didn't use the government to get there each time. It was different each time, but the theory, or the through line, is the grassroots coordinating efforts. So I think there's just, the questions that come from that is, so in the next one, do we just concentrate there, instead of, how does that work? How does that look? What morals are in play? Why is the vaccine hesitancy? What are the, but it often goes back to the liberty argument. And then the disinformation that spread that puts doubt in people's minds about the quality of the testing, the impact of the testing, and who's giving the tests. Okay, morality. So debates over personal choices are especially emotional as they bring up issues of morality. And so many health problems have their roots in what are perceived by many to be unhealthy behaviors that are so personal and intimate that moralists oppose even discussing them. So moralists are people who promote the role of policy as a way to control behavior that they think is wrong. It's immoral. So like casual sex, gambling, drinking, abortion. Moralism in our own state, just as a through line again, has impacted HPV policy in Iowa. So just a few years ago, school health classes were required to include lessons on HPV and the HPV vaccine. But that was recently removed, the requirement anyways. So arguably people can continue, health educators can continue to provide that information. But you have to look at the politics of the surrounding area and see what kind of pressure may come down. I've been told, and this is rumor, that the state is not allowed to say HPV or to promote HVP. So again, I think this is still very much here. And it's about, if you don't say anything or you don't tell kids about sex, they'll just never find out. Louise, you're laughing. They're not going to find out if you don't say it. Stop telling them about it. It's your fault. All right. Anyways, I was just reading something about Florida changing their Board of Education stripped the sexual health curriculum down to abstinence only education, which, it's not that that is wrong to promote abstinence from sex, but it's one of many ways to kind of promote safety and sexual health. So it's one of many things. It should not be the only thing, but that's a way of regulating people's behavior when you don't want them to act in ways you don't want them to act. So sexually transmitted diseases, oh, that's fuzzy when I put it up here. Okay, that's noted. So sexually transmitted infections have been a big part of public health history in Iowa. When the greatest generation's soldiers came home from winning World War II, they brought home some venereal diseases from their activities overseas. And it just prompted a public health campaign that was passed in 1919 called the Venereal Diseases Act of 1919. But this is an example of a bill that was introduced, House File 175 by a fellow named Coakley. And in it, it says it's a felony to have intercourse if you have an STI, or they said venereal disease. And you can't even sleep in the same room as someone afflicted with it, or use the same toilet, or it's illegal. So I did not follow the history of this specific bill, but I could, because the Legislative Assembly actually has these laws all the way back to when Iowa was a territory, which is really neat to actually read a book. And that's what I pretty much did. I was reading a book that would tell a story. If I had the year, I could go back to the General Assembly's website and find the law, who find information about who proposed it, how far it went. You can see all of the governor's speeches. I mean, just a wonderful archive in and of itself. Newspapers.com is the same way. It's an archive of Iowa newspapers, really national newspapers, but Iowa specifically. And you can see all these tiny little mom and pop papers that, were opened, that were started and folded over the years, but all these cities had their own papers, and it's really neat to go into those archives and read the language and how these topics were discussed. But the Venereal Disease Act of 1919, researching that introduced me to a really interesting woman named Dr. Jean Dean Throckmorton. And she graduated from Simpson College in Indianola in 1904 with a PhD degree, which I think we can all celebrate as likely unusual for the time. She received her medical degree from Keokuk Medical College in 1907, and continued to do academic pursuits at the University of Nebraska. She spent 12 years as a general practitioner, 7 of them with the US Public Health Department. And so, because of her expertise, she was enlisted by the State Board of Health to become a state lecturer for women and girls under the Iowa State Board of Health program that was passed, the Venereal Disease Act. So she would go around and talk to women about the dangers of venereal diseases and how this is a huge op-ed that she wrote in the Register, by the way. And so this is where, when you read it, these are the explanations. And so it's interesting because it's a progressive voice on the need to talk about sexual health. So she's basically saying, like, it's wrong. Like this political, or this cartoon here is the kind of preparation for marriage given by the parents of the past generation. So it's basically none. So you just kind of fall off a cliff once you get married. You don't know how your bits and pieces work, I guess. But so she's calling that wrong, that there needs to be more information. But what's funny is that then she talks about how women are responsible for the morality in the culture, and therefore it is up to us to rein in the lack of moral behavior in the community that is causing these infections. And her last paragraph of this op-ed says, venereal diseases remit from immorality. Immorality resulting from vulgar sex thinking, and vulgar sex thinking begins in early childhood. Mothers everywhere realized this, but felt unable to cope with the program. It was pitiful to see the many anxious mothers desiring instruction for themselves so that they might rightly pass this knowledge to their children, the parents to the future race. So she told, I would just love to hear or to read what these lectures said. And I think you can, because there are a couple of boxes of her things, of her papers and whatnot at the State Historical Society. So arguably, in joining this project, we can go down to the Historical Society, rifle through some of her stuff, and see what we come up with on how to really identify when public health is kind of being aligned, for better or for worse, with morality, and how that might how that's pros and cons for us as a field, and how we might try to avoid getting mixed up in who's a good person and who's a bad person. I don't want to make that call. I probably could, but I don't know if I would want to professionally. But if you were to be from Pottawatomie County and want to drive in for a day, we go to the state capitol or the state historical building and look through these papers, we would have the funding to reimburse you for your mileage and meal expense, because we have that grant. So again, those second pieces, I'm giving you an incomplete presentation, and it's because we're still exploring. When I was getting into this, I realized there's so much that this is just a process. Like, there are so many ways that we can explore what was going on and apply it. I mean, surely you guys heard similarities of your own own work, own lived experience in public health as it stands year to date. And if you find it confusing, this is one way, or if you even find that the public health community right now doesn't offer a space where you can sort of process through some of the things that happen that are controversial. You want to process through conversations of morals and ethics in public health, and thinking through the persuasive communication of your next public health campaign so that you are just kind of aware. I mean, a lot of this is just about building awareness so you can really, in a framework, think through what might create public backlash to your campaign, to your ideas, to just public health in general. So our first meeting will be kind of informational on January 6th at noon. Our first deliverable from the grant comes kind of soon. It involves designing a display that can be used around the state next year for the 100th year anniversary, and also at the State House, perhaps during our Day on the Hill. So we'll be working with a graphic designer to do that work. So if you're interested, there'll be more information coming out in newsletters. If you have an intern or a student that you think would be up for this work, it will be paid $15 an hour. Please send me a name so you can contact me or Kim or Lena, and they will connect you to me. So I will pause there and answer questions. I see some stuff in the chat. What is the status of raw milk sales in Iowa? When did pasteurization in Iowa become required by law? Okay, Larry, so those are the questions you would bring to the table. I'm not a public health history expert. I'm working on it, but I'm not. So I don't know. I can find out for you, and that's the skill set that we would learn about. Like, I would love to transfer my ability to do research, legal research in Iowa, to other people in the public health community, so that we could find out the answer to your question. The status of raw milk sales, I'm pretty sure that you can do, gosh, someone in environmental health should probably jump in, because I want to say that they have loosened the
Yeah,
laws.
they've
And I
loosened
think
that last year. So
it's
I
like
tried to look
individual
around,
sales,
Larry.
right?
I feel
Huh?
like a lot of stuff this is where, yeah, you definitely need to do research, because I think a lot of stuff was taken off of websites. I was looking for raw milk stuff as far as when the pasteurization became required, and now that it is not required in a lot of situations. It's interesting. So yeah, I think we'd have to do some digging. Obviously, from the federal level, there's set laws for interstate milk sales, but yeah, each state it's different. So that's a fascinating one. But yeah, that's one of the first, as far as kind of those things that fell last session. So we're thinking other things will topple after that. So we'll see.
The slow erosion. I mean, even with the local control piece, the preemption. I mean, if you're a public health person that advocates for a minimum wage increase, they took away that local control when Johnson County. We have to blame everything on Johnson County for being so progressive that they put a big target out. But it's, we can't do the minimum wage. We cannot do mask mandates anymore. So it's just slow erosion of public health authority that we can talk about too. I'm glad people find this interesting. I always worry that I'm like a big old nerd. I really was like, I named my child after Abraham Lincoln. I was Abraham Lincoln for Halloween in the 5th grade, and just like for no reason memorized the Gettysburg Address. Like, so it's nice to see other people are, yeah. Okay, so come hang out if you want to, and learn some things. It's, no pressure. It's just something we're going to be doing next year. And I kind of picture it as we all meet, touch base, and then kind of make it a working meeting. Maybe you go into breakout rooms, do your research, and then come back with questions if you get stuck somewhere, and we can work through it together.
Yeah. All right, so there might be some more questions, but I'm going to do my official like closing thing so I don't forget that. So Lena knows that I did it in her absence. So, okay, thank you so much, Deborah, for sharing with us today. This is a little bit different Lunch and Learn. We have a call to action. We can all get engaged in this. And I think what Deborah, I don't know if you did mention this, but there will be a couple of presentations at PHCI. So look forward
Oh, yeah.
to continuation of that. We're
I'll
going
be
to
doing that too. I'll have an abstract, so there'll be
Yes.
more about this. Yeah, thanks.
Yeah, Deborah will be doing that. We'll be doing some more specific vaccine hesitancy stuff in the history and yeah, that will be great. So we're always looking for potential topics for future Lunch and Learns. So please share your ideas, help showcase your work or others' work. We have lots of opportunities in the future. You can email IPHA staff if you have any ideas. And our email addresses are our name at iowapha.org or the info at iowapha.org. I'll put that in the chat. So, and then as a reminder, IPHA is your public health association. We're made up of members across the state who work in public health and public health adjacent agencies and organizations. So as we just learned, participation and engagement is very important. If you're not yet a member, it's not too late. Consider how to join, learn how to join this great organization. And there, while you're there, consider making IPHA part of your year-end donation, making a donation to keep our work as the independent voice for public health in Iowa strong. So thank you so much, Deborah. If there's any more questions, we'll hang out for a couple of minutes, but hopefully many of you that were engaged and intrigued will want to help out with this group. You can get, as Deborah said, as into the weeds as you want, as engaged as you want, but we definitely need more people helping us out. So thank you, Deborah. Any last words?
No, have a good holiday. Nice, safe holiday.
Yes. Take care, everyone. Stay healthy.